Our next topic is bloodborne pathogens. We've all heard of HIV and hepatitis B and C. These are the most notorious examples of bloodborne pathogens, diseases which are transmitted when the blood or body fluid from an infected person enters a rescuer's body. During CPR and first aid, rescuers can be exposed to bloodborne pathogens. Fortunately, with the use of preventive techniques and personal protective equipment, exposure can be greatly reduced. How do we prevent exposure? To know how to prevent it, we first need to understand how it occurs. There are two methods of exposure: through a direct splash in a rescuer's eyes, mouth, or nose, or through a break in the rescuer's skin, such as a scab, a fresh cut, a puncture, or a rash. OSHA requires professional rescuers and healthcare providers to use standard precautions when treating patients. First, assume that all body fluids are infectious. Second, use personal protective equipment whenever there is a risk of exposure. Personal protective equipment, or PPE, includes the use of moisture-proof gloves, protective goggles, and a CPR barrier device for rescue breathing. Unfortunately, even with proper protection, exposure can sometimes occur. If you are exposed to blood or body fluids, take the following steps. Wash any exposed area immediately with soap and warm water. If splashes to nose, mouth, or eyes have occurred, flush the affected area thoroughly with water. Dispose of any contaminated clothing or objects in an approved leak-proof container. Report the exposure to your supervisor and follow up with a physician.